Happy Wellness Wednesday. And I have Ann Edwards, physical therapist and owner of Restore Therapy Spa in Westminster, Maryland, with me tonight. Welcome, Ann.
Hi, it's great to be here.
So we're just a little bit later tonight because Ann is a busy physical therapist and entrepreneur and running her own business. And she had clients up until a little bit ago. So thanks for fitting us in. I know you have a super busy schedule, but we want to highlight some of the things that you offer. For everyone that's local to Westminster, you really have a little gem of a place, and you all provide modalities that for people, if they're not in Westminster, I want them to know about them, to seek them out in their own area. So we will get to all those specifics, but first, let's learn a little bit about Ann. So as I said, Ann has a doctorate in physical therapy and is the owner of Restore Therapy Spa and has been a treating physical therapist for 18 years. Is that number still right? Yes.
I think we're approaching 19.
19, getting there. And Ann has evolved her practice into a holistic wellness spa where she specializes in dry needling. And it has always been her mission to offer natural solutions to improve patients' health and quality of life. So the services at Restore that are offered are combined with the dramatic results of dry needling, which is fantastic for pain relief. She can share more about that. And she's gotten lots of amazing feedback. I haven't done dry needling, but I can give amazing feedback on the other stuff. So I'll share personal experience as we get there. So, and tell us about, a little deeper into your bio. So where did you grow up? What do you love to do? How did you become a physical therapist? Give us a little story.
Oh my. So I grew up in Pennsylvania, Chambersburg, Pennsylvania, and I ended up going to Penn State. That is where I learned about physical therapy, and I I volunteered at the physical therapy clinic there on campus, and I really liked it. So that led me to go to grad school for physical therapy. So then I got out, started working in corporate PT, worked for NovaCare Rehabilitation for about 10 years. And I was the sole PT at that practice for most of the time, had some assistants with me and everything. So I was up in Town for all of that. And so it's, small town. I got to see everything from babies to 95-year-olds. So it was a really good experience to broaden, my horizon and get, a good chance to see all kinds of different conditions.
Right.
So I did that for about 10 years and then decided to do some home care for a little bit. That was interesting. Did that for 3-4 years, and then realized that my passion was really with orthopedics and treating pain. I liked the results of getting someone from being in pain to, getting back to life and, not having, those difficulties anymore. So I learned dry needling and started, playing around with that. And, it was amazing, the changes that my patients were receiving. So I said, this is what I got to do. So then it's very scary. But then I opened my own practice and did that for 2 or 3 years. And then once that was established, that's when Restore Therapy Spa was born. And we expanded into a smaller location than what we're in now, and had services like massage and the whole body cryotherapy and an infrared sauna. Started small with those things, and then we were getting kind of busy, which was good. Needed more space, and then moved into the location that we're at now. That was in March of 2020 of all time. We were there for about a week, and then the whole COVID thing set in. So that gave us a lot of time to get organized. So now we're booming, and we've got lots of different holistic services, anywhere from, we've got holistic facials, we've got reflexology and Reiki, a lot of massage, and then more of those wellness services, like the infrared sauna, salt room, things like that.
Yeah. Amazing. And we were trying to figure out how long ago it was when we met, probably at least 10 years ago we were stationed next to each other, side by side at different tables for a health fair, and got to talking. And I had your contact in my phone for many years.
Yeah.
And then I think we saw each other maybe at 2 health fairs.
Yeah.
And when my daughter and I were both receiving treatment for Lyme, our Lyme doctor said, you really should look around for infrared sauna. And I couldn't find it. I thought, I'm going to have to drive an hour to go somewhere else to find a sauna. And it was right after you had opened, and somebody told me, and I was like, you're kidding. There's an infrared sauna in Westminster. We don't have to drive to Baltimore or Frederick. So that was a huge, huge treat. And when I walked in, it was an immediate sense of, it was peaceful, it was calm, it was beautiful. And then I went to one of your ladies' nights, and we were just treated like gold. It was amazing. Beautiful food, your own cozy little robe. So when you go through the modalities, I'll share my personal experience from that. But then the new space that you're in, just across the parking lot from where you were before, also beautiful. All of my interactions with all of your staff have been top notch. You've hired great people there. So congratulations for this amazing business that you've created.
Thank you. Thank you. It's been a labor of love, I would say. Yeah.
So what does a typical day look like for you from a therapy perspective, but also as a businesswoman? What does your life look like?
Well, as most business owners know, no day is ever the same. But I mean, I would say I treat, 20 to 25 hours a week. I'm doing my dry needling treatments with my patients. Other than that, it's, administrative, working on, meetings with the marketing or with my manager, or, things like that. And just thinking of ways to better the business. And, we like to have staff meetings and educational get-togethers for the staff, so that they're keeping up to date on the latest with the services that we're offering and things like that.
Yeah, that's awesome. So I'll definitely circle back to promotions and specials, because you have a lot of really nice things that are offered for all of our local people. But let's dive in to the benefits of some of the modalities that you offer specifically for brain health, because we're in the brain wellness and dementia prevention community. And there are 3 modalities that you mentioned that you wanted to highlight. So we're going to look at the cryotherapy, and the infrared sauna, and the lymphatic drainage, right?
Correct. Yes.
Okay. So do you want to start with the cryotherapy? So tell people what the heck that even is. And I tell people that I've done that, they're like, what? How cold was it?
Oh, it is so amazing.
It is awesome.
It sounds scarier than it is. And that's what everybody that gets in, they're a little petrified at first. But afterwards, it's very, very manageable. So basically it's a big tube that basically you step into, and we lift you up so that your head is sticking out the top. You need to have your skin exposed, so you're either nude or wearing like a bathing suit or bra and underwear, that kind of thing. And then we put very cold, dry air around you. A lot of people describe it as kind of like having a cold cloud around you for 3 minutes. So many benefits with this. You know, a lot of people, athletes are doing it. It's kind of like the, what's it called? The cold immersion that they were doing. This is a much gentler form of that than the ice baths. Also really good for arthritis, which we'll talk about. It's good for, you know, just recovery in general from injuries and surgeries. It's going to be good for the immune system. It is, you know, gives you an energy boost. So there's a lot of benefits in those 3 minutes. And it's really cool because the research is starting to show that there's long lasting benefits. If you do a cycle of these sessions, it's not just while you're in there. It's not just, you know, the couple of days after. Sometimes it's a month or two after. Once you start to make some significant changes in your body, it's gonna hold. So really nice quality of life changes for a lot of people.
Yeah. So my personal experience, which I'll add here, is so what I went in for the women's wellness, the ladies' night, and you know, had my big comfy warm robe on.
Yep.
And then stepped up onto this like movable floor, and they closed the door. So it's like a big, like a tall circular room. And then the floor raises up. So you're, like you said, your head sticking out the top. And then I derobed and passed that over the top, but I also had on socks and mittens. Do you still do that?
Yes.
So hands and feet. So for anybody who is sensitive to the cold, that was really helpful. Like, I think I had double layered socks and mittens. Yep. And the first, I'm sensitive to cold, and I also have multiple sclerosis. And I didn't even know it until after the fact that it is recommended for people with MS, because it reduces inflammation. So for the first minute, maybe I was like, you know, if you run outside in the winter to the car and don't put your coat on, it kind of feels like that. And then the next minute gets a little colder. And for the last minute, you're like, okay, I'm ready to get out soon. And then it's over.
Yeah. And
then they pass your robe over the top and you get out, and I got a cup of hot tea handed to me. And then I couldn't believe the amazing sense of relaxation that then just hit, like all your muscles relax. I am not the kind of person that can like take a 3-minute cold shower. I have worked myself up to like 30 seconds of cold water at the end of my shower. And that is a big deal for me. Like I started with just cold water on my face and then built up to maybe 5 seconds on my chest. And I tolerated it pretty well for 3 minutes. So highly recommend it to decrease inflammation. There are also antioxidant benefits that I just learned about today. It reduces inflammation and provides antioxidant effects. And in theory, we don't have any studies yet that I know of, but if it's reducing inflammation and increasing antioxidant benefits, then it also could reduce the risk of dementia and Alzheimer's, because we know that inflammation is a major driver in dementia and Alzheimer's. So just wanted to highlight that. Do you have anything else you want to add for the cryotherapy?
I guess, you know, thinking more about the science of what's happening with the cryo, like you said, you know, you get in your cold at first, obviously, but what's happening in your body is the vasoconstriction. So all of your blood vessels, they're constricting, they're closing up, and they're pushing all of that blood into your core, which is where you get a lot of the benefits, because you're creating this hyperfiltration of your blood. So you're pulling inflammatory chemicals out, you're oxygenating your blood because you're speeding up that whole process of filtration in your body. So that is one of the main in benefits, is that constriction of the blood vessel. And then when you get out, like you said, you feel relaxed, you feel good, because your blood vessels then expand to 4 times their normal size. So you are getting all of this fresh oxygenated blood pouring out into your extremities to warm you up. But that's coming with all the benefits of the nutrients and everything else that it's delivering.
Right. Awesome.
Yeah. Yeah.
It's like
Cool
I
stuff.
wanted someone else to drive me home after that. I was like, oh, I'm so relaxed.
Really? A lot of people notice an energy boost though too, because
Oh, really?
I mean, again, the science behind it, it's going to boost your endorphins. So that's why a lot of people will like to do it, because we have one patient that comes in and says, she says, I need to do this on Saturday mornings so that I can get my chores done around the house and deal with the kids and all of that. Yeah, it gives her an energy boost, and it gives her this nice, it's not like caffeine energy. It's this nice, calm energy and focus.
Yep, I can see that too.
Yeah.
Awesome.
Yeah.
What time do you close in the evening? Just wondering.
7 o'clock.
7. Okay.
Yeah.
I could do that for a bedtime routine.
Yeah.
Be the last person of the day, get someone else to drive me home, have some tea and head to bed.
Yeah. But there is that, I said it gives an energy boost, but it's also reducing cortisol. So you're getting that's your stress hormone. So it is squelching that stress hormone, which we all need.
Absolutely.
Yeah.
Yeah. Awesome. So that can be good to go to bed or to wake up. I can see it working both ways.
Mm-hmm.
Awesome. Okay. So are we ready to move on to the infrared sauna to talk about what that looks like, what that feels like, and what it's good for?
Yeah. Did you want to talk about the benefits of cryo for MS?
Yeah. If you have specific information, please. Yes.
Yeah. So, there's actually quite a few studies about they're looking at specific changes in the MS patient when they've done whole body cryotherapy. And they're finding that it's improving quality of life. They're getting decreased depressive symptoms, energy and mood is increasing, and less fatigue and pain. So they're looking at different, markers for these patients, and it's all good.
Yeah.
So
awesome.
Yeah,
yes.
It's and one reason that they believe that it's happening is because of that oxidative stress that it's reducing for those MS patients. So it's definitely something to look into. The only factor that we have to consider for some MS patients is that you have to be able to stand in the chamber for those 3 minutes. So, and I've done a couple of talks with the MS Society, and that was the concern with some of the wheelchair bound patients, that they're not sure if they would have the strength to be able to do that. But for the others, the population that is strong enough, there's some really nice benefits.
Right. Could you fit a walker in there? You could. Not really.
I wouldn't, because it's going to get cold.
Yeah.
And then you wouldn't want to touch it.
Right.
Most people would hold on to the edge. Is how they would have to do it. So we'd have to screen to make sure that you were able to.
Right.
But yeah, it's worth it. But most of the studies were saying 2 to 3 times a week will help to manage the MS symptoms.
Right. So it can be used as treatment, and it can also be used in a preventative fashion to reduce risk going forward.
Definitely. Yeah.
Awesome.
Mm-hmm. Yeah.
So I didn't want to cut you off. Sorry about that. Is there anything else you wanted to share about cryo before we go?
I think that was all that that was
okay. It. Awesome. Okay. So on to the infrared sauna.
Okay. I'll make my computer work here. So the infrared sauna, and I think it's important for people to understand what's different about the infrared sauna versus a regular sauna. So a lot of people are used to the sauna that you get in, and it's either this hot steam or the dry sauna that's 200 plus degrees. This is quite different because it's using infrared energy to heat the sauna and your body. Our saunas are full spectrum infrared sauna, so we're getting all the different wavelengths, which will help at different, depths of the body. We've got the far infrared that's going to be more of that superficial, and then there's the mid, and then the near. I have that backwards. The far infrared is the one that goes further into the body. And then the near infrared is helping more of the skin conditions. And the mid is going to help with more of that in between, like cardiovascular health, that kind of thing. So the infrared sauna, when you're in there, you're getting the benefit of the heat plus the infrared light and energy. And what that does for detoxification is it's going to actually pull out more toxins at a deeper level than just sweating when you exercise or sweating in one of those regular saunas. So it's an important distinction. And a lot of people say that they can handle an infrared sauna much better than a typical sauna because it's not as hot. It's 130 to 150 is a good range to get benefits. Okay. As opposed to like 200 plus.
Right. And it's usually recommended that you start slow and build up time-wise in there.
It depends on your condition. So
okay,
if you've got a lot going on, if you're a sicker individual where you have, conditions where you have a high level of toxicity, you need to start slow because your body's going to start detoxing pretty quickly, and you want to make sure that you can handle it. People that are, relatively healthy athletes, 25-year-olds, that are running around and feel fine, then you can usually go in, 30, 40 minutes and you're fine. You just have to stay hydrated. It's the main thing.
So the idea is to get in there and sweat, right? Because we're reducing toxins.
And that's one of the benefits of the sauna, but there's also some research that I was reading that shows that the sauna helps with neuron repair. And there's this, and I have to look at my notes for this, but there's a brain-derived neurotrophic factor called BDNF, and saunas are increasing this factor. Right. So this is what that's a bit deep, but this is what this means. It actually helps the body to grow new brain cells and helps the existing brain cells survive. Is that not the coolest thing?
That's amazing. Yes.
Yeah. And it's also good for neuroplasticity, which is helpful for learning new tasks and improving long-term memory. So to me, that sounds like the elderly person who's trying to prevent Alzheimer's. Yep. So this is huge. The saunas, they also can help with norepinephrine, which helps with your focus and attention. So getting in the sauna, you're going to have less brain fog. So there's so many benefits. And the coolest one that I saw, and I feel like there needs to be more studies on this, but it actually promotes myelin growth. And if you know MS is when the myelin starts to degrade in the central nervous system. But saunas there's this thing called prolactin that promotes myelin growth. But I couldn't find specific studies that were linking the two, which was driving me.
Yeah, I haven't heard that. I have heard of a Finnish study, and I don't know I read about it in a book, so I haven't read the original study itself, but it was in the Dr. Bredesen and the End of Alzheimer's book. I'm looking at it over there, and that's where I'm doing my health coach training. And the Finnish study. Oh, here's Rocco pushing his way. Sorry, my dog's behind me. But this this Finnish study, of course, in Finland, many people have a sauna in their home. So they are doing saunas multiple times a week. And they found a 50% reduction in dementia with those people who did saunas multiple times a week.
Yeah, I think I saw a similar study with the 2,300 middle-aged Finnish men.
Yep, that's it.
Yeah, and the numbers I have are 66% less dementia and 65% less Alzheimer's, and improvements in cardiovascular health.
Yeah, it's amazing.
It is amazing. It was only on the men for some reason.
Right.
But they were saying it likely will cross over to others, and they took lifestyle into account and socioeconomic factors and everything. So they found a really clear association with sauna.
Yeah. Yeah, that's amazing. I'm going to circle back to something that you mentioned earlier. And you said this would be a good thing for elderly patients to do to prevent dementia. And I just want to put out there that we don't want to wait until we're elderly.
No.
We want to focus on brain wellness and dementia prevention in our 30s, 40s, and 50s, because brain changes start about 20 years before symptoms appear.
Wow.
So we want to get in the sauna and do the cryotherapy, now. You and me now, 30s, 40s, 50s.
Definitely.
So give that to your girlfriends for a thank you gift.
Yeah.
You don't wait to give it to your grandma when she's 80. So yes. Do you have to, what I want to know is, do you have to sweat to reap the benefits? Do you know? No.
I think we're talking about two different things.
Okay.
The BDNF and the norepinephrine and the prolactin, I think that's just the exposure to the heat and to the infrared. The sweating, I think, is a separate thing. The sweating is the removal of toxins from the body. So they're both beneficial.
Absolutely.
But in different ways.
Right.
Because the Finnish study was, I don't think they were using infrared saunas. I think they were just looking at the heat in general. Right. So it would be something interesting to study the difference between the types of saunas and the benefits that you get from the infrared versus the others.
Right.
That would be very interesting.
Right. Because Dr. Bredesen calls the toxins and things that contribute to dementia dementagens. And these toxins that are all around us, sprayed on our food and in the air we breathe and in the products that we put in our hair and on our skin, and we can minimize, but we can't totally avoid. And, however long you've lived in this earth, your body has taken in toxins and then stored it away in your fat cells to protect you. So when you lose fat, then these toxins are released when the fat is fading away. So, and when you're doing weight loss, it's really beneficial to also do sauna and sweat and then take a shower very soon afterward with a very clean, healthy, natural soap. So that even like a Castile soap, and get those toxins off because they will come out of your skin. So don't go run your errands and spend the day in your sweaty clothes and sweaty skin after you've done a sauna. So in the End of Alzheimer's book, sauna is mentioned in 6 different places, mostly about the benefits of reducing toxins by sweating them out. But also the benefits of improved sleep
Mm.
And when we have improved sleep, that also improves our brain health and also decreased stress. And when we have decreased stress, like you mentioned, lowering cortisol before, that improves our brain health. So it's multifactorial. Lots of benefits from the sauna.
There really is. Yeah. And have you heard of the mice study where they discovered the lymphatic system in the brain?
Yes, the glial cells. Yes.
Yeah. So, I guess recently this was discovered, I guess not even 5 years ago.
Yeah, it's pretty recent.
Yeah, that they realized that our brain also has a lymphatic system. So we have it throughout our entire body, but it's in the brain as well, which I'm not.
They call it the glymphatic system is what they call it. So we need to get into deep sleep. So the brain shrinks a little bit. So there's more space for basically like the garbage truck to come through and collect the dirt and get rid of it. But if we don't get into that deep sleep, our brain has a hard time cleaning out. So really, really important to get into deep sleep, and relaxing with a sauna can help.
That was mind blowing to me that there was that much of a connection between getting into a deep sleep and allowing your brain to detox.
Yeah.
I think more people need to understand that. And it puts the importance of sleep to an entirely new level.
Yeah. Don't skimp on it. 5 hours is not enough.
Yeah.
Yeah.
Makes a lot of sense.
Right.
Yeah. Well, good. And the other thing with that, I was trying to figure out, because we have something called the Balancer Pro, which is a lymphatic drainage system, which also helps with it's detoxification, basically. So it's a very high tech, basically like pair of pants or a jacket that you put on that helps to remove toxins from your body with sequential, very precise pressures that's moving the lymphatics into the ducts so that you can excrete the toxins. So maybe if there's a connection, but I was trying to figure out if the brain, if you drain everything in the body, are you encouraging the drain in the brain as well?
No, they're separate systems. So the glymphatic system and the lymphatic system are separate, and the glymphatic system works during sleep. The lymphatic system, we need movement to get the lymph system to process or to move the toxins out of the body, not like the circulation where the heart's pushing things through. Like, we have to actively move. I have a little rebounder next to me, where a little mini trampoline. I use that to jump on to also stimulate the lymph system. And there's lymph massage that you can do, but this is one that I haven't tried, the one that you mentioned. So share some more about your lymphatic. So it's a Balancer Pro, you called it?
It's called Balancer Pro. It's a hospital grade machine that can be used for even lymphedema if needed, but it has 12 different sensors along each side, so it knows precisely how much pressure it is applying, which is important with the lymphatic system, because if you crush the lymphatic vessels, you're not moving anything. So we make sure that we're in that range, usually 40 to 50 millimeters of mercury, that will allow movement of the fluid through the vessels, but not like clamping down on a garden hose where you're compressing it and not allowing it to move.
Okay. Yeah, because my dad was asking me who I'm interviewing tonight, and I was telling him about what we were going to talk about. And he said, so do they have different size garments basically to put on for different size people? So that's my question for you. How do you, yes?
Yeah, they're very adaptable.
Okay.
So we can get almost anyone into these.
Okay. So is there like a Velcro closure, or how does it go on?
So we zip it up, and
Okay.
there's 3 different levels automatically, and then we have extender pieces that we can add to it.
Okay.
And then the feet are kind of open so that, you know, a shorter leg would just stop before a longer leg would.
Okay. And how do people respond to that? Do they report being relaxed, or
It's very relaxing.
yeah?
Yeah,
Like a
it's like,
massage?
yeah, like a very relaxing rhythmical massage. And very, very effective to drain the lymphatics. Some people have said they've lost a few pounds immediately of fluid. We've seen significant changes in circumference of limbs afterwards. For those that are coming for that, we'll measure before and after. So it's an amazing machine.
Wow, that's awesome.
Mhm.
So that's one that's on my list to try, because I haven't tried that one yet.
So you should.
And I have taken advantage of your, I don't know the name of it, like you're dabbling, you're sampling, where you can go and get a treatment for a 30-minute for
the trials.
the trials.
Yeah.
Yeah. So I don't want to jump ahead before I know that we've covered everything that we're supposed to cover. Did we say everything that needed to be said in regard to the cryotherapy and the infrared sauna and the lymphatic massage? Yes?
Yes.
Okay. So do you have to, I guess you have to be kind of local to get to benefit from all these procedures, because these are all hands-on, right? There's no, do you do anything virtually?
Our health coach is
Health
starting
coaching?
to do some virtual. Mhm.
Okay. But at least this was a fantastic introduction to some of these modalities that if people aren't local, they can look for in their own area. But if people are local, and I would say, you know, Baltimore to Frederick to York, probably, I mean, if they don't have something in their area, you are worth driving to. So what kind of offerings do you have for someone who wants to try things out?
We do have the trial, so you can come in and try out our services. We call them the basic services. So those are our wellness services, like the whole body cryotherapy, infrared sauna. We have biomat salt room, things like that you can do for $35 for the first time. And then we also have, you know, trials for the massage, for express facials, things like that. Spa days are very popular, especially if you're coming from a little ways away. There you can choose from, you know, maybe you can get an hour massage, then you can get a half an hour facial, and then you could sit in the sauna for half an hour. That would be a mini spa day. And so we have different options where you can kind of customize it based on what you like.
And do you still have a juice bar?
We do, yeah. So there's a juice bar, the Green Leaf Juice Bar. It's not owned by us, but they are, you know, in our space, and they have a lot of really yummy things.
Right. So if you were there for a half day, you could get a refreshment.
Yes.
Yes.
Mm-hmm.
Yeah. That sounds
Yeah.
awesome.
Yeah.
And you have something special on offer coming up in January.
Yes, we're doing our detox weight loss pounds for pounds challenge. So we did this for the first time last year. So it's a program where we help you with weight loss, but our weight loss program is a little bit different in that our focus is detoxification, because like you said earlier, our fat cells hold toxins. So, you know, just by detoxing, you are going to lose weight. And vice versa, if you lose weight without necessarily detoxing, you're more likely to put that weight back on. So that is our focus, is, you know, combining some of the services like the infrared sauna and the Balancer Pro with a customized eating plan, and meeting with our health coach and working with you individually. So we have a couple plans available. And the really neat thing about this is that we donate for every pound that is lost with the program, we donate a pound of food to the local food bank. So that was really nice. We donated about 250 pounds of food last year.
Nice.
Yeah.
That's a great, that's a great combination.
It is.
A win-win all the way around. Yeah.
Yeah.
So if people want to get in touch with you to learn more, what's the best way to do that?
So our website is restoretherapyspa.com. And you could email us at restoretherapyspa@gmail.com. Our phone number is 443-345-4325. And you can call and speak with our receptionist. And we even do free wellness consultations where you can come in and meet with one of our providers and, get a tour of the spa, and you can, really understand what we offer and what things are right for you in our space.
Yeah. I highly recommend it for anybody who's local. It would be an amazing gift for a loved one, or to give to yourself. Love yourself, do some self-care, and spend a day at the spa. Yeah. So Anne, thank you so much for your time and for creating this space in our little town. I'm so glad that you're here.
Oh, it's my pleasure. It was really nice talking to you tonight.
Yeah. Thank you so much. Take care. We'll talk soon.